As the weather gets colder, we're all spending more time indoors. Unfortunately, that means more of us are getting sick.
Doctors warn that RSV, flu, and COVID-19 could create a perfect storm that leads to a surge in pediatric hospitalizations. Newswatch 16's Nikki Kreis explains in tonight's Healthwatch 16 report.
Healthwatch 16 is sponsored by Geisinger Health System.
It's still early in November, and health centers in our region are already seeing an influx of children with respiratory infections. Geisinger doctors say there has been an early surge of RSV, and flu and COVID-19 are not far behind. Capacity is tight at both doctors' offices and hospitals.
Janet Weiss Children's Hospital is near at capacity now, going on many weeks. I think we're going into our third week. Geisinger Wyoming Valley's pediatric beds are also quite tight.
Dr. Stacy Cummings is Geisinger's vice chair of outpatient pediatrics. She says the surge in pediatric respiratory infections is a nationwide problem. Some children are catching more than one illness at a time. RSV and influenza impact the youngest children and the elderly the hardest.
To young children, they really haven't been exposed to a lot of people who have been sick in the last few years. So things that they might have seen a year or two ago, they didn't, and so they're seeing it this year. And so instead of maybe just 1 or 2 year olds being sick, we're seeing 1, 2, 3 and up.
Dr. Cummings is encouraging parents to protect their children from these seasonal viruses by keeping them home when sick. Hand washing is important when it comes to stopping the spread.
Things like rhinovirus and RSV live on surfaces, and so it doesn't mean that someone has to sneeze on you and you breathe it in to get it. It really means they may sneeze on a surface, you touch that surface, or they wipe their nose, which we all know kids do, and then they touch a surface.
Geisinger doctors are also urging parents to make sure their kids are vaccinated against COVID-19 and influenza. Nikki Kreis, Newswatch 16.